Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Heart Association and the American College of Cardiology issued new cholesterol guidelines that mean a greater number of people could be prescribed medication to lower their cholesterol levels. Today, Dr. Douglas Borg with St. Vincent Heart Clinic, Arkansas, joins us to kind of explain this a little bit. Welcome back to the show,
Thank you very much.
Dr.
Appreciate it.
Let's talk about the guidelines first of all. Why did these have to be updated?
Well, the last update was in the early 2000s, so this represents new scientific data that's come out, but it also represents a refinement of what was done before. So there are new drugs. There's just a lot of new considerations have changed since then.
Okay.
So that's the primary reason.
Let's go over the differences between what the guidelines were and what they are now.
Absolutely. So the first main difference is that we're going to notice that there are existing people that were covered under the prior recommendations, but we have a whole new group of people that were not previously recommended for statin use. So there's 4 primary groups that have been identified as being at risk that are recommended for coverage. The first one is people with established cardiovascular disease, such as heart attack, stroke, prior bypass surgery or stents, and then people with peripheral arterial disease. Those people are considered to be in the high-risk category, and so those people are recommended to have what we consider a high-potency statin. The other group, number 2, is anybody with a familial hypercholesterolemia, somebody with remarkably high cholesterol. We know that people that their LDL cholesterol is greater than 190 are at a definite increased risk, and those people were covered before too. Where these guidelines really differ is in what we call primary prevention, people that don't have established heart disease. So diabetics aged 40 to 75, it's recommended that you be on what we consider a more moderate potency statin. So that is a new group that was previously not covered. And then number 4 is a group of primary prevention if your calculated cardiovascular disease risk is also high. And so that risk is calculated based on age and gender, whether you smoke, whether you have high blood pressure, and then also based on your cholesterol. And there's a way that you can calculate that on the internet if you search for cardiovascular risk. That's a very easy thing for you to do on the internet if you're interested for yourself.
So a lot of people may be going back to their primary care doctor, and that doctor may be prescribing this for the first time for them.
Yeah, we're having a lot of discussions with patients that weren't previously on cholesterol medicines and trying to tell them why we think they should be on them all of a sudden. So, their question is, I didn't need it yesterday, why do I need it this time?
Right.
And so we have to kind of cover all that and explain what this is all about.
And you have to explain the risks of having high cholesterol with those, and I think we've got a few of those to share with those. What are just some of the big risks to think about?
Well, the risks potentially of side effects are, the most common one are muscle aches. People complain, well, I get aches if I take these medicines. It tends to be dose related, so the higher or the more we give you, it tends to be more frequent. And it also happens with some medications more than others. So we really kind of have to tailor the dose and the medicine to the individual patient. So while these are guidelines and recommendations, each patient has to have a conversation and sort of an interaction with their physician.
Very good. Medicine is always changing. That's why we have doctors like Dr. Borg to come in and update us and sort of tell us what's going on in the world of medicine. Thank you so much.
Thank you very much.
Let's remind everybody, of course, about St. Vincent Heart Clinic, Arkansas. If you have any questions about this, now you're under these guidelines when you weren't before, they can certainly explain it to you. And if you need to set up an appointment there, they could do that as well, right there on Canis Road. Thank you so much.
Thank you very
Have
much.
a good weekend, Dr.